Hello everyone, my name is Gulbarshin Mukasheva, PhD, Senior Teacher of the Department Epidemiology and Biostatistics. Today I am going to present a lecture on study designs. In this lecture, we will learn what study designs are, their main types, and how they are used in medical research. This slide shows the hierarchy of study designs. At the bottom of the pyramid, we have case reports and case series, which provides the weakest level of evidence. In the middle of observational studies, including cross-sectional, case control, and cohort studies. At the top, we have experimental studies, especially randomized controlled trials, which provides the strongest and most reliable evidence. Study designs can be divided by different criteria. One type is descriptive studies, where we simply describe what we observe. Another type is analytical studies, where we compare and look for relationships between factors. There are also experimental studies, where researchers actively apply an intervention to study its effect. Depending on the scale, studies can be census studies or sample studies. In a census study, the entire population is studied, all members are included. In a sample study, only a certain part of group of the population is studied. Sample studies are more common because they are faster, cheaper, and easier to conduct. A case report describes a single patient or a single case. It's one of the most readable and interesting types of scientific publications. A case report usually presents a rare or unusual conditions and reflects the author's view of a specific problem. It can also help to understand complex clinical situations and report rare side effects. Next study design is case series. Case series describes the clinical cases of several patients, usually 2 or more, allows identifying common features of a disease or condition among a group of people. Patients are observed over time and the results are compared. There are no control groups. Case series is a study of a same intervention in a sequence of individual patients conducted without control groups. Here you can see a scheme of case series studies. 4 patients here, and in hospital, doctor will collect their anamnesis and write one article in medical journal. Case series can be used in several situations. In initial report about a new diagnosis or a description of a new treatment method. Individual reports or the outcomes of doctors or clinic. Creation of multi-center observational registers. The size of a case series can vary from 2-3 cases to hundreds or even thousands. Next study design is cross-sectional studies. Description examines the prevalence of a disease or condition within a specific population at a particular point in time. Purpose of the study design: to determine the prevalence of disease and to preliminarily assess relationships between diseases and risk factors. For example, determining the percentage of people with high blood pressure in a certain region. Here you can see advantages and disadvantages of cross-sectional studies. First, we will start from advantages. Fast and expensive. The study can be conducted in a short period of time and with minimal resources. Determination of prevalence rates. Suitable for assessing the description of a disease or phenomenon at a specific point in time. Study of multiple variables allows evaluating of the influence of several variables simultaneously. Disadvantages: inability to determine cause and effect relationships. Since the study is conducted at a single point in time, it's impossible to identify which phenomenon is the cause and which is the effect. Sampling errors can be in the study and lack of temporal dynamics. Next study design is case control study. A case control study is conducted by comparing individuals who have a specific disease with those who don't have the disease, the control groups. Purpose: to identify potential risk factors for the disease. Features: retrospective study. The study evaluates factors that may have influenced the subjects in the past, sampling cases individuals who have the disease under investigation. Controls: individuals from the same population who don't have the disease. Advantages of case control study: effective for studying rare diseases, time and cost efficient, allows rapid identification of the relationship between exposure factors and disease. Disadvantages: it cannot clearly determine cause and effect relationships. Memory distortion: people may not recall past events accurately. Selecting a wrong control group may distort the results. For example, researchers compare people with lung cancer cases and healthy individuals controls to study their smoking habits. Here you can see scheme of case control study. First of all, you can see here time going to past side. First we will create two groups, case and control groups. In case group, there are patients. In control group, healthy people. And from past time, we will find risk factors. For example, smoking. Like this, we will find risk factors from past time. We will ask from patients, did you smoke it before? Like this. In case control studies, the odds ratio is used to determine the effect of risk factors on the occurrence of disease. Here you can see the formula of odds ratio. Odds ratio equal to A multiple D divided B multiple C. The odds ratio describes how strongly a risk factor is associated with the likelihood of developing a disease. Here, interpreting of odds ratio results. If odds ratio more than 1, the risk factor may increase the likelihood of disease. If odds ratio equal to 1, there is no association between the risk factor and the disease. If odds ratio less than 1, the risk factor may reduce the likelihood of disease. For example, imagine two groups. The first group consists of 200 women diagnosed with a congenital fetal malformation. It's outcome plus group. Among them, 50 women smoked during pregnancy and 150 women didn't smoke during pregnancy. The second group consists of 100 women without signs of congenital fetal malformation. Among these, 10 women smoked during pregnancy and 90 women didn't smoke during pregnancy. For solving this task, we will create like this table. You can see here. First column we will write risk factors, smokers and non-smokers. And next we will write outcome and without outcome, who have disease and without disease, people's numbers, and we will put here A, B, C, D, and we will use these numbers for calculating odds ratio. Let's calculate the odds ratio. Here odds ratio equal to 3. Interpretation: odds ratio 3, it means less than 1. The risk factor may increase the likelihood of developing the disease. Next study design is cohort studies. A cohort studies is an epidemiological, observational, analytical, dynamic study in which a specific group of people, cohort, is followed over a period of time. The purpose of cohort studies is to determine the causes of disease, occurrence, and distribution. For example, a study investigating the relationship between smoking and the development of lung cancer. The group is followed for several years to determine the effect of smoking on cancer risk. Here you can notice long time period, 4 years, and it's prospective study than previous case control study. In this page shown scheme of cohort study. First we will choose cohort from population and we will divide into two groups, smokers and non-smokers. Smokers experimental group, non-smokers comparison group. And we will compare after some time, after a long time, we will compare results in which group developed more sick people. A cohort study can be based on 3 types of data: retrospective, prospective, and combined. But usually cohort study is prospective study. In cohort study also we will create table, 4-cell table, like this. First column is factors, and next we will write people who have disease, people without disease, and we will mark as A, B, C, D, then we will calculate relative risk. In cohort study, we will calculate relative risk. Here formula shown of relative risk and interpretation. If the relative risk equal to 1, then there is no difference between the groups. If relative risk more than 1, it indicates that the event or disease development rate in the first group is higher compared to the second group. If relative risk less than 1, it suggests that the development rate in the first group is lower. Advantages of cohort studies: possibility of obtaining reliable information about the etiology of disease, especially when experimentation is not possible. Reduction of systematic errors, only way to assess absolute, attributable, and relative risk indicators of disease development and to evaluate the etiological contribution of conditions associated with the prognostic risk factors, allows for the evaluating of a wide range of outcomes and effects, ability to identify rare causes, possibility of predicting the development and progression of disease. It's easier to avoid errors in creating the experimental and control groups in cohort studies as they are formed after the effects being studied identified. Disadvantages of cohort studies: expensive research not used for studying rare diseases, loss of participants in the follow-up period, impossibility of studying multiple risk factors. Next study design is clinical trials. Controlled studies: compare a drug or procedure with other drugs or procedures, more likely to detect differences in treatment outcomes. Controlled studies are divided into randomized and non-randomized types. Uncontrolled studies describe the use or experience of a drug or procedure without comparison to another treatment option, less common and less reliable. The likelihood of performing procedures for comparison is higher than for comparing different drugs. Here shown a scheme of controlled clinical trials. First, we will create two groups: group of interest, comparison group. For example, cancer patients, non-patients. And we will take histories there and we will compare their anamnesis. Advantages and disadvantages of observational clinical studies. Advantages: provides the best quality data for patients, has minimal bias, systematic error, best design for evaluating the effectiveness and safety of interventions. When randomized, it's the most reliable study design. Disadvantages: often requires a long period of time to conduct, very expensive, not suitable for studying rare diseases. Randomized controlled trial: the gold standard for any diagnosis and treatment method. Typically, participants in this study are randomly divided into two groups: randomized, the experimental group where the intervention being studied is applied, and the control group where a placebo or another intervention is applied. Randomization is carried out using various methods, random number tables, computer programs, and etc. Randomized controlled trial: comparison of final outcomes. The study is conducted in two groups of patients. Control group receives no treatment or receives standard treatment or placebo. Active treatment group receives the treatment being studied to evaluate its effectiveness. You can see a scheme of randomized controlled trial. First we will select selection group, then we will do randomization and we will divide into two groups, A and B, and we will compare effectiveness of each drug or each methods in which group was more improvement. Types of blindness: simple blind trial, when the treatment method is known to the researcher but unknown to the patient. Double-blind trial, when the patient's group assignment is unknown to both the patient and the researcher. Triple-blind trial, when the results of randomization are hidden not only from the patient and researcher, but also statistician analyzing the data. Here control groups: placebo-controlled, active treatment, comparative description of doses. Here placebo means which looks like drug but no any effect like drug. Active treatment means like we will use traditional treatment, and comparative description of doses, we will use different doses for two different groups. Thank you for your attention.